Is your doctor blaming you for your IVF failure? Every patient does an IVF cycle with the hope that it's going to be their first and their last. They're very optimistic, and especially when the doctor tells them the cycle was a perfect cycle, the embryos are good quality embryos, that they are going to get pregnant, and doctors are very optimistic at the time of the transfer. But when the beta HCG level comes back and it's negative and the cycle has failed, these very same doctors will then go on to blame the patient for the IVF failure. They'll say things like, I did everything possible, but your embryo quality wasn't good. Or I did everything possible, but your embryo didn't implant because you didn't rest enough, or you were too stressed out, or you're too fat, or your sperms aren't good, or all kinds of ridiculous, specious, and completely false reasons. This is partly because doctors don't want to take on the responsibility for the failure. Because when cycles fail, patients want answers. And then what are the things you can blame? You can, of course, blame the doctor. And doctors will say, no, sorry, it wasn't my fault, and there's nothing much the patient can do about that. The patient will often end up blaming herself. And in fact, the doctor will add to this by saying, oh, it's because you didn't do this, or because you didn't do this, or because you said something hot or cold, or you were too stressed, or you went to work, or some ridiculous reason. And it's not just doctors who blame patients for IVF failures. And it's not just the patients who blame themselves. It's often relatives and friends and family who don't know any better who will blame the patients for the failure. And of course, at the end of the day, you can blame God, but that's not really going to help. What am I trying to emphasize is that the important thing is that you need a doctor who will explain to you why the cycle failed. Often the truthful answer is we don't know why the cycle failed, but you want a doctor who will be transparent, responsible, accountable, professional, and who will share information with you, and who will share information with you proactively while the IVF cycle is going on. So that this doctor will show you what your endometrium looks like on the ultrasound scans. He will show you what your follicles look like during the cycle. He will give you photographs of your embryos before transferring them, so that you have peace of mind that top quality embryos were transferred smoothly under ultrasound guidance into a prepared endometrium. Now, if after that the IVF cycle fails, then really no one is to blame. The success rate is not 100%. And once an embryo is inside the uterus, because implantation is a biological process, it's not a process which either you can control or the doctor can control. But if the doctor is blaming you for the IVF failure, especially when he told you that he put good quality embryos, and especially when he doesn't share photographs of the embryos, this is a huge red flag. That means he is either hiding information for you or not being honest, and you definitely need to get a second opinion and definitely need to find a better doctor who will share information and give you photographs of your embryos routinely, and who will take responsibility for the fact that outcomes are uncertain, but the process itself should be a happy and a positive one, and will not blame you when the cycle fails, because that's like blaming the victim, and it's a very unkind and unfair thing to do.